Hi, I'm Dr. Ken Snyder, and this is Dr. Betzy Leyva. And we're here at the St. Vincent de Paul Charity Dental Clinic in South Phoenix. And once again, welcome to another episode of Betsy's Journal as we chronicle her rise from high school and even coming across as an immigrant, and how she became now a full-fledged dentist, and not only that, but a staff dentist here at St. Vincent de Paul. So, Betsy, let's kind of get right into it, Net. You've been back for a few months now.
Yeah.
What's it like to be back?
It's amazing. It's like still like surreal. Like I can't believe that I'm actually back as staff dentist now. Yeah. So I mean, but it's great.
It's amazing. Now, one thing that you have a huge advantage, over most dentists, is that you were also a dental assistant.
Yes.
So you've actually experienced all three things. You've been a patient in the chair, you've been a dental assistant, and now you've been a dentist. Which is hardest?
Yeah, a patient, being a patient.
Did you have an inherent fear of going to the dentist?
I think so. I mean, I really don't remember anything. I mean, when I was little, like going to the dentist, but I do remember when I was little, like I had like those little silver teeth.
Oh, okay.
Yeah, it was like from canine to canine. And also, I remember there's an actual picture of me. It was a kindergarten picture. But I had my missing teeth in the front.
I think I'm not alone in saying we'd love to see that picture. So if you can dig it up, maybe we can put it on in one of the future programs and let people see.
Okay.
And I myself as a child, we didn't. I mean, we had access to a dentist, but we didn't have access to routine care. My father worked in the mills, and if something hurt, that's when we went to the dentist. So I've experienced even early on in childhood having extractions and being in the chair, and I think it really helps a lot. I know like certain students are coming through dental school and they say, well, I've never had a filling or I've never had Novocaine, and I applaud that. That's terrific, but I think it really helps to know what it feels like to be numb, what it feels like to have that drill in your mouth and all that. Do you feel that being a dental assistant helped you quite a bit in getting through dental school?
Oh yeah, I did. It was very helpful actually, just because I already knew the terminology, procedures. So I had a huge advantage, and I think I remember sometimes I would teach my classmates some stuff too. So I mean, it was good. It helped me a lot.
Blood.
I've seen blood, and I know I did not faint, so I was
that
fine
weeds
with that.
some people out right away.
Yep,
It's how would you describe so when you were an assistant and you were not quite a dentist yet, were there certain misconceptions you had about? In other words, you thought, well, why doesn't he hurry up and do this, or why doesn't he?
Oh, yeah.
Or are there things that changed then once you were on the other side of the chair?
Yeah.
What would be one or two of those things?
I mean, I would be like, oh, the dental student, is prepping for a filling, or preparing a tooth for a crown or whatever. But I would be like, oh, come on, just do it fast. It's, right there, easy. But now, it's not. You have to think about more of like the patient, because you actually have something that you can. It makes sound, it drills, it cuts tooth. So, I mean, if the patient moves a certain way, you can cut him. Also like thinking about the medical history, the patient's behavior. So, it's so many things. It's not just like, okay, go ahead and cut the tooth. It's you have to see the whole thing too. So,
yeah, and one of the gentlemen who, actually the gentleman, Dr. Earl Baker, who he and a nurse, Janice Ertl, founded this overall clinic, dental and medical. And Dr. Baker, he became my idol. He's passed now for some years, but he actually did the first ever open heart surgery here in Arizona. He was head of the Maricopa County Medical Association for many years. And when it came time to retire, he didn't. He actually founded this clinic for the
Oh, wow,
working
yeah.
poor, people who have no access to care. But one day, he changed my perspective a lot, because one day he was at the entrance to the dental clinic, and he was just standing there, just smiling, smiling. And I paused for a moment and, just come over and say, "Hey, how are you doing, Dr. Baker?" and blah, blah, blah. And he said, "I am just amazed standing here." And I said, "Oh, you are?" And yeah. He goes, he said, day in, day out, you and your staff, you're doing surgeries. And it never dawned on me, even putting in a filling is a surgery. Like by definition, anytime you, do something to the body that's irreversible, it's surgery,
Oh.
And so I know maybe I'm changing your perspective as we speak, and it dawned on me, we are actually, just because the patient isn't asleep and you don't have their chest pried open working on their heart or whatever, we are actually doing surgeries, unless we're only doing a cleaning or fluoride or sealants. But anytime we cut into any part of the body, be it tissue, be it tooth structure, whatever, we are actually doing surgery, because that's basically irreversible. And so wow, it really changed my perspective.
It's changing mine right now too.
It does, doesn't it? It makes you stop and think.
Yeah.
Not you don't take it seriously, but this is what we do. So being here now, do you think that as a dentist, having been on the other side of the chair as a dental assistant, it's helped you to better utilize your dental assistants?
Yes, and I feel now that I can I know what they're thinking, and then also I can also, it helps me train them, so that I can, I don't know, help them see that it's just not I am not just cutting a tooth. It's there's more to that. It's you have to see multiple things. But yeah, I think it helps a lot that I was an assistant, so I can help my assistant to understand why I'm doing something, and it's not just go ahead and do it.
And I have the highest respect for dental assistants. I've been so lucky to have wonderful dental assistants my whole career. And and a lot of times in medicine, if you're not doing surgery, that doctor, the assistant might come in, take your blood pressure, your temperature, and then leave, and then the doc comes in by himself, he does the exam. But dentistry actually requires 4 hands, and in some cases 6 hands, because you have to obviously you have to be able to remove the saliva and the water from the handpiece. You have to make sure the tongue and the cheek are out of the way as the dentist is there and putting the filling material in. You have to mix it and make sure deliver it at the right spot. In surgery, you're placing an implant. It's so important to get from both angles. Is this going in straight? And so the dental assistants are invaluable to a practice. So in returning here, what would you say has been the most joyous part?
I think it's being again together with what I call my family.
Your work family.
Yeah, my work family. So being again together with them, and then I would say just serving the people that we do, and just letting also our patients know that this is like a wonderful, it's like a, how would I say, like a diamond in the what is it?
In the rough, they call it, diamond.
Or like a needle in a haystack or something like that. It's like you don't see it anywhere. And they're so lucky to have people. I don't know. I think they're so lucky to have people like you, like us, like the dental assistants, or a place like this, that they can come here and get their dental needs. And I mean, not only the adults, but also the kids too. So.
And knowing you all these years, I mean, inside or outside the clinic, you're a happy, joyous person. And I think to the population we serve, that's so important.
Yeah.
Because so often, they're down on their luck, and we just may be the highlight of their day. You wouldn't think going to the dentist would be the highlight of the day, but we've seen it. We are, because of how the staff treats them and how welcome they feel, and they feel like they're part of a family. And a lot of the people that we treat actually don't feel like they're part of much of anything. So if we can give them not only good quality dental treatment, but even that little bit of joy in their day, it makes it all
Makes a
very
difference,
much worthwhile. Yeah. What and maybe trouble's not the right word, but what frustrates you? Like you say, this is a unique place, but in general, like public health, what frustrates you?
Well, I would say maybe that there's not a lot of places like this. I mean, the public health that can, it can help the people that need it, and provide them with their dental needs or like medical, whatever they need. Mostly, mainly that. Yeah.
And one thing that's kept me here all these years is not only in the dental, but in the medical clinic, but throughout the whole campus. We cut through the red tape pretty fast.
Yeah.
A lot of government agencies, not so easy to do, and I think a lot of our patients, or people who potentially could be treated here, they get frustrated because they can't, negotiate the paperwork and all the different regulations. We're here. Hey, you show up, we're going to take care of you. So I kind of like that. We have the freedom to just be dentists and physicians and do our work. Wow. Is there anything you'd like to say to possibly potential donors or people who might be interested in learning more about the clinic?
Yeah, I would say, you guys don't know how great this place is, and I would welcome any of you to come by and then check it out. Come see our wall of smiles. Come and meet Dr. Snyder and the assistants here. And you'll see, like, one of the big things that that a lot of the dental students or pre-dental students, they say, even the residents too, it's like what they like about this place is that they can feel like how close we are to one another, like that family vibe. Come over and see for yourself how amazing this place is and why I came back, why I keep coming back. Nobody can, I tell Alexander, I'm here for forever. As long as you're here, I'm here too.
And you mentioned about meet me, but to be honest, I think it's a no-brainer. If you can meet and have a tour by me, this old codger, or this lovely woman sitting next to me, intelligent, everything. But either way, we'll both be glad, or both together, whatever. But we'd love to have you come down and show you what we do and see if there's a way you'd like to get involved and help us with our mission. So until next time, as always, be true to your teeth, and they won't be false to you. Bye-bye.